periodontal therapy on the clinical periodontal inflammatory parameters in beta-thalassemia major patients with gingivitis. The presentation goes like this. First, I will be discussing about the background of the project, the literature overview, why the study was selected, what is the significance of the study, material and methods, results and discussions, then conclusions, strengths, limitations, and future recommendations. So the research objective was to evaluate clinical periodontal inflammatory parameters in beta-thalassemia major patients with gingivitis. For the background and literature overview, if you see this picture, this is showing a normal hemoglobin which has 2 beta globin chains and 2 alpha globin chains. Whereas if you see in this picture, in the beta thalassemia major patients, the beta globin chains are defected or reduced or absent. So the beta thalassemia patients suffer from hemolysis and ineffective erythropoiesis. If you see this red blood cell, it is now bombarded with excessive toxic alpha globin chain aggregates, which leads to extramedullary and intramedullary happenings. In extramedullary, the RBC undergoes hemolysis, and intramedullary, the RBCs undergo apoptosis and ineffective erythropoiesis, which leads to anemia that requires constant medical attention and blood transfusion for survival. Thalassemia is the most prevalent genetic disorder in the world, with WHO reporting around 60,000 infants afflicted with thalassemia major born every year. Pakistan represents one of the highest burden countries for thalassemia, with an estimated 5,000 to 9,000 children affected with beta thalassemia born each year in Pakistan. The Thalassemia Federation of Pakistan reports a prevalence of 6% for beta thalassemia major in Pakistani population. WHO has warranted priority control for the blood disorders, especially beta thalassemia in the third world countries. So there are certain salient orofacial features of patients with beta thalassemia. If you can see in the intraoral picture and the extraoral picture, there is enlargement of the upper jaw, which gives a classic chipmunk face to the affected individuals. There is migration and spacing of upper anterior teeth. There is increased dental decay. There is increased periodontal problems, chicken wire-like radiologic appearance of the alveolar bone. There is mucosal pallor and dental discoloration, sore or burning tongue. And then there is classic Brody syndrome, which means mandibular arch is telescoped inside the maxilla. Periodontal diseases are a group of infectious inflammatory diseases which affect the supporting structures of the teeth, gingiva, alveolar bone, cementum, and pedial fibers. Microbial dysbiosis, along with the host immune inflammatory response, leads to inflammation and periodontal tissue destruction that results in the clinical presentation of the disease. Periodontal diseases begin with gingivitis, which is the localized inflammation of the gingiva initiated by bacterial plaque, a biofilm that forms on teeth and gingiva. So the literature tells that there is increased prevalence of gingivitis in beta thalassemia major patients because there is xerostomia in these patients, as they are unable to close their mouth over proclined teeth. That leads to inability of the patients to benefit from the salivary local immune defense against gingivitis. Then, of course, there is compromised oral hygiene, malocclusion, and chronic anoxemia. Moreover, these patients have affected local defense mechanism. Their neutrophils and B lymphocytes fail to respond effectively against gingival inflammation in patients with gingivitis. We have seen a lot of literature that tells that gingival and periodontal conditions have their effects and association with systemic conditions. It is because of the shared risk factors, oxidative stress, and cytokines. There are a lot of systemic conditions in the literature, such as chronic kidney disease, atherosclerotic cardiovascular disease, diabetes, adverse pregnancy outcomes, rheumatoid arthritis, obesity, etc., which have been proven to have a dual association with systemic conditions as well as gingival and periodontal conditions. Therefore, it was hypothesized that periodontal conditions and thalassemia could be affecting each other as well, because in diseases with neutrophil dysfunctions, periodontal tissue is lost very rapidly. And TM-beta patients also exhibit defective neutrophils and macrophages with compromised capability of phagocytosis. When there is supplementary gingival inflammation, it can alter the clinical signs of both the chronic diseases, that is thalassemia and gingivitis. So why was non-surgical periodontal treatment chosen for the beta thalassemia patients? It is the gold standard in the treatment and management of periodontal inflammatory conditions. It consistently demonstrates improvement in clinical periodontal disease parameters, that is a reduction in pocket depth and reduction in bleeding on probing. It includes professional supra and subgingival scaling and root planing, supragingival polishing, and elective adjunctive therapy, that is chemical and antimicrobial intervention. It has been showing consistent results since decades. A study in 1992 and the study in 2018, they both demonstrated consistent improvement in the periodontal disease parameters. So the significance of the study is that this is the first study in this population to evaluate the effect of NSPT on the clinical periodontal parameters. Thereby, on the basis of the results, tailored oral hygiene care program for this particular cohort is emphasized upon and warranted. If we have identified the association between periodontal health status and TM beta, we can help in directing care and attention towards the preventive and therapeutic strategies to manage thalassemia with neutrophils and macrophages, shared risk factors, and elevated systemic inflammatory burden due to periodontal microbial invasion, which is delineated as the link between periodontal and systemic conditions. We are attempting at controlling the invasion of neutrophils and preventing exacerbated activation of macrophages, which secrete pro-inflammatory cytokines and can impact the systemic inflammatory status of the patient. So coming to the materials and methods, this study is essentially a pre and post clinical experimental study. According to the sample size, 31 patients were selected for each group, one group with the pre and post, and the sampling technique was consecutive non-probability sampling. After the inclusion and the exclusion criteria, the patients were screened and a team of healthcare personnel, including hematologist, family physician, cardiologist, and the dentist, all the recruited patients were then screened for the study. Every patient had been informed about the treatment protocol and every patient had signed the informed consent before proceeding with this treatment protocol. So the clinical periodontal inflammatory markers were collected via the indices, 2 bleeding indices, 1 plaque index, and periodontal pocket depth were recorded for checking the clinical periodontal inflammatory markers. This was a specially designed chart for this study. And for the non-surgical periodontal therapy, scaling and polishing were done. The brushing technique, that is Fohn's circular technique, was taught to all individuals. Chlorhexidine 0.2% was given to all the individuals to be used twice a day for 14 days. This is the picture of the pre and post scaling in a patient with β-Thalassemia major. The demographic characteristics of the patients were that there were a total of 31 patients with 16 male and 15 females with a mean age of 13.36 plus minus 2.84. Of the 31 patients, all of the patients were either taking DFX or DFP for eye insulation, and 28% of the patients presented with hepatosplenomegaly. For the inter-examiner reliability, 5 valid cases were counted and then stats were taken. For the kappa value of 1, a perfect agreement was achieved for the intra-examiner reliability. In this study, not only are we checking for the gingivitis status, but also we have stratified the severity of gingivitis according to gender. And it was interesting to find that there was no gender predilection for the severity of gingivitis in these cases. Pair test analysis was performed for GI score, plaque score, and PBI, whereas a Wilcoxon sign rank test was performed for periodontal pocket depth. It was very heartening to see that highly significant improvement in all clinical periodontal inflammatory markers was found. It evades the doubts on the systemic ability of the TMB patients to respond to NSPT, as these patients do present with defective neutrophil function, which renders them prone to subsequent infections. At the start of the study, we had no healthy recruits. However, at 6 weeks after the intervention, we had 16% of the individuals which showed healthy status of the gingival health. Moreover, at the start of the study, we had 42% of the patients who presented with severe form of gingivitis, and at the 6 weeks follow-up, that count had reduced to 10%. Our study showed 86% of the screened individuals had gingivitis, which is also the case with other studies which are showing increased prevalence of gingivitis in these patients. However, there are a few studies which also quote that there is no significant difference in the clinical parameters for gingival diseases in these patients when it was compared with the healthy controls. In the local context, despite the disease burden, unfortunately, there are no reported studies in the country regarding any aspect of the thalassemia, especially catering to oral health. There was just one study conducted in 2018 that reported higher prevalence of gingival diseases in thalassemia patients. Our study showed positive effect of NSPT on clinical periodontal parameters. The same has been confirmed by other studies as well. We had reduction in plaque scores and bleeding scores. It was also found in another study by Wong, where they also had reduced plaque scores and periodontal bleeding scores after the follow-up. The present study shows decrease in pocket depth, which was also found the same was found in another study in 2018 in type 2 diabetic individuals, where the pocket depth decreased from 3 mm to 1.9 mm. Again, the NSPT is effective in patients with periodontal conditions and systemic diseases. So when the NSPT results were compared in pregnant women, diabetic patients, and there was a systemic review about the systemic conditions, there was consistent reporting of improved clinical periodontal parameters in individuals with all the systemic diseases and conditions. In conclusion, the results of the study show that with proper protocol, multidisciplinary approach, and careful screening of the systemic status of the patient, this cohort of patients responds positively to local measures of plaque control without additional systemic antibiotic coverage. However, the author does not recommend the similar regime in all of the thalassemia patients. The results of the study open another debate that there is an unavailability of experienced doctors and dental professionals to deal with patients with special medical considerations. Although poor oral hygiene and general unawareness and disregard toward oral health by the individuals and their families is a contributing factors, it cannot be foregone that dentists do lack expertise in treating patients with thalassemia. Although there are thalassemia preventive legislations in Pakistan, there exists regulatory oversight in the planning since the legislations did not take into account any public and professional dialogue. The management of thalassemia is it's a very easily preventable disease. However, the burden keeps on increasing because of lack of preventive measures and protocol. There are currently more than 40 thalassemia centers currently operating across the country, but they are just mainly focusing on transfusional supports. These centers lack the multi-specialty treatment facilities, mostly because of the lack of government support, unawareness about other systemic health challenges, including oral health. So the strengths of the study are that was the pioneer study to evaluate clinical periodontal parameters and the effect of NSPT on these patients. It adds to the prevalence database of gingivitis for thalassemia patients. And this study is a promising gateway to explore a new therapeutic modality to reduce systemic burden of the disease. The limitations include non-probability consecutive sampling, and due to resource constraints, a robust sample of thalassemia patients from across the country was not possible. In the future recommendations, I would suggest that to further validate the finding, the study should be tested on a larger cohort, and a specially designed oral care maintenance program for the thalassemia patients is needed, and the dentists need to be trained with special training to be dealing with immunologically compromised group. These are my references. Thank you so much for listening. Thank you so much for your time. I have done my